Hi everybody, my name is Dan Tobin. I'm the Medical Director for the Chase Outpatient Center, and I think I'll be meeting you shortly. You're probably watching this on a bus ride on your way here, so hopefully I'll get a chance to show you around in person and introduce myself to you face to face. What you're probably... I don't know how to turn that off.
Don't worry about it, it doesn't bother you.
What you're probably thinking as you're on your way to Chase is, what's the place going to look like? What do the rooms look like? What do the walls look like? You know, what's the physical space impression? I know when I was interviewing, that was the first impression left on me. I can tell you it's pretty nice, actually, but probably that's not the most important thing that you should take away from your experience here. And what I want to convince you of is that we care more about the philosophy and what you'll get out of your training working with us in the primary care residency program than the actual physical space that you're going to work in. But let's talk about the physical space. It's big. There's 24 exam rooms. The resident room has a skylight, which is nice. And if I had my way, that would have been my office, but I don't have that much authority, I guess. You'll find that we've got pretty much all the amenities that you'd need in a modern, practice setting. But what matters far more is the time you spend here, the relationships you develop with the staff, with your patients, and also with your mentors and the faculty who work here. We're trying to teach you that being a doctor is far more than seeing patients, far more than just writing a prescription. It's a philosophy that this patient is somebody that you care for, whether you're physically here or you're not here. You're in the hospital, you're on another rotation, even at a different hospital. The patient needs care whenever they need care. So care has to be available to them 24 hours a day, 7 days a week. And so you have to develop a partnership with your colleagues that allows you to function that way. And so that's what we're trying to teach you. It's to have ownership of your practice and of your patients and their health. To do that effectively, you need to trust your colleagues. You need to know that your preceptors are here for you when you're not. And vice versa. You may be asked to help out with some of the care that we provide to our direct patients as well. And that's okay, because really what you are is a junior partner. You're not just a resident who's here to sort of watch what we do, but you're a participant in this place. And as a director, I care very, very much about what it is you see we're doing well and what it is you see that we can work on, and to strive to make it better always, because we should never rest on our laurels and be happy that we're doing, quote unquote, the best we can. There's always room to improve. And so I think that together we can partner and continue to make this a real cutting edge place to practice primary care. I should mention that in addition to primary care, there's a lot of stuff going on at the Chase Outpatient Center that you'll get to see. Because even though it's about 15 to 20,000 patient visits a year, and most of that time is primary care driven, there's an orthopedic clinic, there's a surgery clinic, podiatry, so we have surgical subspecialties here, rheumatology and a procedure clinic. We have a psychiatrist from Yale who's here. We've got a psychologist who specializes in motivational interviewing, a Coumadin clinic, which I direct. There's a chronic disease management clinic. There's a multi-specialty diabetes clinic, and on and on. And so really, we have quite a bit happening here day to day, and I should say that a lot of it's done on a purely voluntary basis. We have patients here who struggle with how to pay their bills. About 65% of our patients have state insurance, or much smaller number, but a significant number have no resources at all. So that shouldn't exclude them from getting the care that they need. So as an example, the behavioral health clinic with our psychologist, behavioral change like quitting smoking or stopping drinking or taking your medicines, that's all free of charge. We don't bill for that care. And I wouldn't have it any other way, because our patients really do need that care. And so much of what we try to do is be creative. How can we use the resources that we have optimally? How could you partner with us to do that? And I think you'll see that in a patient population that needs so much, we really do everything we can to try to help. Another example of that is the Waterbury Health Access Program. So when a patient can't pay their bills, can't afford their medicines, we don't just give up. We have people who are on site who are caseworkers and care coordinators. Their job is not to be a care coordinator in the traditional setting. It's to try to access these resources and, for example, get free medications from pharma if they qualify. or to have care donated so that they don't have any bills. And the system that they use is not just here at this place either. It exists at the hospital. And so there's an attempt to coordinate the care between the ER, the inpatient setting, the outpatient setting, other outpatient settings, and really have more of an effort toward a medical home where we can manage our patients whether they're here physically or not. There's so much more to tell you, and you'll see it yourself, and you'll have people babbling at you all the time. So I'll end my babble now by just welcoming you and telling you I'm looking forward to seeing you. If you do join us, please stop by my office anytime. I'm looking forward to working with you. Thank you. All right.
Well, and not on the fly.
And not on the fly.
All right. Anytime.
Hi, everybody. I'm Dan Tobin. I think you're watching this on a bus ride over to the Chase Outpatient Center, and hopefully pretty soon I'll get to meet you in person. But until that time, let me introduce you to Chase and to our philosophy here in the primary care program, so that when you are here, you'll notice more than just the physical space we're in, and maybe can focus a little bit more on the things it's harder to teach and to talk about, which is the philosophy on being a doctor. So at the Chase Outpatient Center, you might notice when you walk in that it's pretty big. It's got 24 exam rooms. It has a skylight in the resident room. These are all really nice things. It's located right across from the hospital. But really, in my opinion, all those things don't matter. What really matters is the fact that as part of the primary care program, you'll be part of a team where you're a junior partner. And the care that you provide at the Chase Outpatient Center will be you owning your patients, whether the care is physically here, at the hospital, or after hours, because being a doctor means that you're a doctor all the time, and your patients have needs that go beyond their visit. And so hopefully in partnering with your mentors and your preceptors and your colleagues, we can teach you that being part of a team and working in a system where you're part of the solution to try to make sure we're providing care at all times when it's needed is really the key to being a really competent and creative, cutting-edge primary care physician. Primary care is also knowing how and when to access specialty care if it's needed. And I'll mention that even though most of the volume here, which is about 15,000 to 20,000 patient visits every year, is driven by primary care, we have plenty of subspecialists that are going to partner with you, including orthopedics and surgery and podiatry and psychiatry and psychology, rheumatology and a multidisciplinary diabetes clinic, and plenty more that aren't on site but are available by referral. Now, one of the things you might be asking is, well, by referral, does that mean I have to worry about the patient's insurance? And of course that's true. And many of our patients don't have very good insurance or don't have a lot of money. But we've done a lot to try to provide access to care for patients who don't have a lot of access otherwise. And that includes the Waterbury Health Access Program, which if patients are short on resources, they can apply for free care or discounted care. They can apply to get medications for free from drug companies. And it's so wonderful having them on site in an office 2 doors down from my own so that I can turn to them and say, please help me. And this way my patient can partner with us as a practice to get the care that they need. We're always trying to learn to advocate in new ways and to be part of a team. And I hope that if you were to join us, you'll join our team, you'll join our feeling that we always need to improve, that we should never rest on our laurels, but we need to try to learn from our mistakes and enhance what we do well. And that's really the cornerstone of being an excellent primary care program. I'm looking forward to meeting you. It's my pleasure to talk to you here. I hope you have a very good interview and good luck the rest of the day.